coronavirus oo laga helay dalka Kenya iyadoo lagu arkay haweeney dalka dib ugu soo laabatay kadib safar ay ku tagtay wadanka Mareykanka iyadoo soo martay London ee boqortooyada Ingiriiska. wasiirka caafimaadka Kenya oo shir jirayd ku qabtay magaalada Nairobi ayaa shaaca ka qaaday in haweeneyda laga helay caabuqa corona ay xaaladeedu tahay mid degan iyadoo awooda inay neefsato waxna cunto balse aan la sii dayn doonin ilaa inta laga xaqiijinayo in cudurka ay ka buskootay. wasiirka caafimaadka Kenya ayaa sheegay in haweeneyda lagu karantiilay qayb ka mid ah isbitaalka Kenyatta National Hospital iyadoo dawladdu ay baadi goobayso dadka ay suurtagal ka tahay in xiriirka ay la sameysay.
And members of the press and fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
xubnaha warbaahinta iyo
Before touching the mask, clean your hands. Inspect it for tears or holes. Verify which side is the top. This is where the metal piece is. Then identify the inside of the mask, which is usually the white side. Fit the mask on your face. Pinch the metal strip or stiff edge so it molds to the shape of your nose. Adjust the mask on your face, covering your mouth and chin, making sure there are no gaps between your face and mask. Do not touch the front of the mask while using it. If you accidentally touch it, clean your hands. To take off the mask, remove the elastics from behind without touching the front and keep it away from your face. Discard it immediately in a closed bin and clean your hands. It is also important not to reuse a mask. Replace it with a new one as soon as it gets damp.
The coronavirus has now spread both inside and outside China, and the WHO has declared this a public health emergency. In this very first broadcast, let's find out more information about this coronavirus. In December 2019, there was a cluster of pneumonia cases in China investigation that it was caused by a previously unknown virus, now named the 2019 coronavirus. A coronavirus is one of many viruses that cause disease in mammals and birds. In humans, coronaviruses cause respiratory tract infections that are typically mild, such as the common cold. The rare forms such as SARS, MERS, and COVID-19 can be lethal. A novel coronavirus is a new strain that has not been previously identified in humans. Coronavirus is not known how it transmitted, exact dynamic yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something has been contaminated with the virus.
Clean your hands regularly with an alcohol-based hand rub, or wash them with soap and water. Touching your face after touching contaminated surfaces or sick people is one of the ways the coronavirus can be transmitted. Protect yourself and others from getting sick after coughing or sneezing, when caring for the sick, before, during and after you prepare food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste.
There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with elbow like this, or use a tissue. If you use a tissue, discard it immediately into a closed bin. Avoid close contact with anyone that has fever and cough. And if you have fever, cough, and difficulty breathing, seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions I just explained and make sure you stay home until recovery. If you need more information on how to protect yourself from the new coronavirus, check who.int. There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with elbow like this, or use a tissue. If you use a tissue, discard it immediately into a closed bin. Avoid closed